Equipments.
Hello ma'am, my name is Jana Faye. I'm Sabilio, a BSN1 student batch 2. So today I'm going to perform a head-to-toe assessment. So first thing you're going to do is you have to perform a hand hygiene. Then after that is you have to introduce yourself to the patient. Hello ma'am, my name is Jana Faye. I will be your nurse for today. Is that okay for you ma'am? Then after that is you have to confirm the patient ID using a patient's um, identifiers like the name. So what is your name, ma'am?
Sadal,
Adele. So your birthday.
February 6, 2010,
Then how old are you?
11.
Then and also the date of admission. So next is you're going to ask your patient. So, ma'am, who is the president of the Philippines?
Rodrigo Duterte.
Okay.
It is a good idea to begin a hands-on physical examination by taking the vital sign. To measure axillary temperature, hold the electronic thermometer under the axilla firmly by having the client hold the arm down and cross the chest. Wait until it makes sounds. To measure the respiratory rate, place the one arm of the patient in her diaphragm and count the rise and fall in 1 full minute.
Next is complete necessary focus assessment. So, in step 1, you have to observe the general appearance. Alteration may reflect neurologic impairment, oral injury or impairment, improperly fitting dentures, differences in dialect or language, or potential mental illness. Unusual findings should be followed up the focused neurological system assessment. Then you have to observe the behavior, the level of hygiene, the body position, patient mobility, speech pattern, and articulation.
Inspect scalp for lesion and hair and scalp for presence of lice and or nits. Check hair for the presence of lice and or nits, which is egg, which are oval in shape and adhere for the hair shaft. Inspect amount of distribution of scalp, body, axilla, and pubic hair. Look for unusual growth elsewhere on the body. Inspect skin for edema. Palpate skin for temperature, moisture, and texture. Inspect nails for consistency, color, and capillary refill. Observe the face for symmetry, facial features, expression, and skin condition. Check the function of cranial nerve 7. Have the client smile. Frown show teeth. Blow out cheeks. Raise eyebrows. And tightly close eyes.
Evaluate the function of cranial nerve 5 using the two ends of paper clip opened to 5 millimeters. Touch the forehead, cheeks, and chin to see if the client identify whether the touch by both ends stimulously. Palpate the temporal arteries for elasticity and tenderness. Then, The client to open and close the mouth. Can you open and close your mouth, ma'am? And palpate the temporomandibular joint for tenderness, swelling, and crepitation. Determine the function. Test vision using Snellen chart.
E F B T O Z L P E T B E C F D E D F C V P F E L O P Z Q D E F B O T E C L E F F O D F O T F D F L D C E O E F B E O C L P E T B E C F D E D F C Z B F E L O P Z D E F B D O C L B E D B E C F D D E F C Z P P P D L O P E D.
Inspect eye for drainage. Check eye for drainage, pupil size, and reaction to light. Drainage may indicate infection, allergy, or injury. Inspect eye for papillary reaction to light. Slow reaction to light or unequal reaction bilaterally may indicate neurological impairment. Use the ophthalmoscope to inspect the shape, color, size, and physiologic cup. Use cotton bulb to check the reaction of the eyelashes. Both eyelashes are equal symmetric.
Imagine that this is an otoscope, so we have to use this one for her ears, to inspect her ears.
Inspect the auricle, tragus, and lobule for shape, position, lesion, discoloration, and discharge. Palpate the auricle and masted process for tenderness. Use the otoscope for external auditory canal for color and cerumen or airwax, tympanic membrane for color, shape, consistency, and landmarks.
So next is the whisper test. Then that this is a Weber test. So sample that this. Inspect the external nose for color, shape, and consistency. Then, check the patency of airflow through the nostrils.
Test cranial nerve 1. Ask the client to close eyes and smell. Use an otoscope with short, wide speculum to inspect the internal nose for color and integrity for nasal mucosa, nasal septum, and inferior and middle turbinates. Inspect mouth, tongue, and teeth for moisture, color, denture. Inspect the teeth for numbers and condition. Check the gums and buccal mucosa for color, consistency, and lesion. Test cranial nerve 10. Touch the soft palate to assess the gag reflex. Ask the client to say ah and observe the rise of uvula. Inspect the tonsils for color, size, lesion, and exudate. Inspect the tongue for color, moisture, size, and texture. Inspect the ventral surface of the tongue for frenulum, color, lesions, and Wharton ducts. Palpate the tongue for lesions. Test cranial nerve 9 and cranial nerve 10. Assess the tongue strength by asking the client to press tongue against tongue blade. Assess cranial nerve 7 and cranial nerve 9. Have the client close eyes. Check taste by placing salt, sugar, or lemon on the tongue.
Sour.
Inspect the neck for lesion, masses, swelling, and symmetry. Test the range of motion. The neck should be symmetric without masses. The neck is straight, no jugular distension, and symmetrical. Palpate the preocular, postauricular, occipital, tonsillar, submandibular, submental, superficial, deep cervical pain, posterior cervical, and supraclavicular lymph nodes. Palpate the trachea. Make sure the trachea is palpable. Auscultate and enlarge thyroid for bruit. If a bruit is present, do not proceed to palpate. Palpate the thyroid gland size, irregularity, and masses. Auscultate the carotid arteries for bruit. If a bruit is present, do not proceed to palpate. There are no visible lumps seen in the neck. Inspect the upper extremities for overall skin coloration, textures, and moisture. Test the function of cranial nerve 11 spinal by shoulder shrug and turning head against resistance. Palpate the shoulders and arms for tenderness, swelling, and temperature. Test ROM of the shoulders and elbow. Palpate the brachial pulse. Palpate the ulnar and the radial pulses. Test range of motion of the wrist. Inspect the palms of the hand and palpate for temperature. Test the ROM of both fingers. Assess the biceps, triceps, and brachioradialis flexus. Test the alternating movements of the hand. Skin color is light brown without edema and lesions. Ask the client to close eyes. Test the bilateral sensation. Assess light touch and pain sensation in scattered location over the hands of the arms. If light touch and pain are not intact, test the temperature sensation. Evaluate the position senses of the finger. Assess fine motor function. Test stereognosis. Then, assess gravitation by writing a number or letter in the palms on the client's hand. Inspect the configuration and shape of their scapulae and chest wall.
Chest expansion may be asymmetrical with conditions such as atelectasis, pneumonia, fractured ribs, or pneumothorax. In expecting the client, there is an abnormal findings, which is the Drachenfrax or varicella. Palpate for tenderness, sensation, crepitus, massas, lesion, and firmitus. Evaluate chest expansion at levels. Chest expansion may be asymmetrical with conditions such as atelectasis, pneumonia, ribs, or pneumothorax.
Percus for tone at the apex above the clavicle, then the intercostal spaces, comparing bilaterally. Auscultate for the anterior breath sounds, adventitious sounds, and voice sounds. The presence of crackles or wheezing must be further assessed, documented, and reported. Pinch skin over the sternum to assess mobility or ease to pinch and trigger or return to original shape.
Palpate each breast, tail, obspens, areola, and nipples for discharge.
Palpate the axilla for rashes or infection and the anterior, central, and posterior lymph nodes. Abdominal distension may indicate ascites associated with conditions such as heart failure, cirrhosis, and pancreatitis. Hyperactive bowel sound may indicate bowel obstruction, gastroenteritis, or subsiding paralyticilium. Hypoactive or absent bowel sound may be present after abdominal surgery or with peritonitis or paralyticilium. Deeply palpate the aorta, liver, spleen, and kidney for enlargement or irregularities. Pain and tenderness may indicate underlying inflammatory condition such as peritonitis, such as the overall skin coloration, texture, moisture, massas, lesion, and varicositis. Note hair distribution. Palpate the joints of the hips and test ROM. Palpate for edema, skin temperature, muscle size, and tone of the legs and feet. Palpate the knees, including the popliteal pulse. Palpate the ankles. Assess the dorsalis pedis and posterior tibial pulses bilaterally. Test ROM. Assess the capillary refill. Check the capillary refill, depress the nail edge to cause blanching and then release. Color should return to the nail instantly in less than 3 seconds. If it takes longer, this suggests decreased peripheral perfusion and may indicate cardiovascular or respiratory dysfunction. Perform heel to shine test. Fine motor function, vibratory sensation or bony surface of grade 2. Then sensation to dull and sharp sensation. Assist the client to sit on the side of the examination table. Assess the patellar, Achilles, and plantar reflexes. Assess dorflex and plantar feet against resistance. Note the strength and quality. Check skin integrity and pressure areas and ensure follow-up in depth assessment of patient mobility and need for regular changes in position. Palpate the CWMS and capillary refill. Note the color, warmth, movement, and sensation of the feet and should be checked and compared to determine accuracy of perfusion. Turn your patient to side and ask or sit up to lean forward. Observe spinal curvature and check for scoliosis. Observe the client as you ask the client to walk in heel-to-toe fashion. Hop in one leg, then the other leg. Perform finger-to-nose test. Perform Romberg test. Stand close to client.